And welcome back to the Healthy Zone. Joining me now is Dr. Sam Shatkin from Aesthetic Associates. Thank you so much for being here.
Great to be here.
We're going to talk about a lot of things. We're going to talk about liposuction. When somebody comes into your office and has got the mindset that they want to make some changes in their bodies, what are the first things you talk to them about?
Well, before we consider any surgery, we would like to make sure that they understand that in order to do surgery on them, they have to be healthy and, make the commitment on their own. Because it's not just about taking fat away, it's about, reshaping the body and a lot of things Derek talked about a few minutes ago about being healthy, and that's important.
And you like to make sure they're on that healthy track before you would make any changes?
Always do, always do.
How can liposuction be done in a healthy way? And I know you brought some instruments along. Show me.
Well, I'd like to show you that. The healthy track is, making sure they're eating properly, they're near their ideal weight if they can, as best they can. And then what we have left is some localized body fat, that's where liposuction comes in. Now, I brought these both to show because when I started in practice in 1989,
wow,
22 years ago, this is the size of the cannula we're using to remove the fat. Large hole, taking chunks of fat out each time.
Right.
Now we're basically sculpting this. And look at the size of this cannula. This is 3 millimeters versus about 10 millimeters there.
It still looks scary to me.
Well, you know what? This is a sculpting tool, basically. In the right hands of the board-certified plastic surgeon, he will shape and contour areas of contouring that we need to improve on. A lot of patients will lose all the weight either with Derek's help or their proper diet, or they can work with us in our classes that we have. But essentially, whatever's left is what we can work on to shape. And we sculpt it just like an artist would sculpture a piece of stone or a piece of wood to make it what they want.
All right, let's see some of your work right here. I know that one of these, this is a tummy tuck, right?
Well, yeah, I just want to qualify. I don't mind showing my patient photos, and we have them in the office, but for privacy purposes, these are photos that are made available from the American Society of Plastic Surgeons.
Gotcha.
But this is a before and after of a tummy tuck, and this patient had that skin tightening. It's a little bit cut off on the one side of the screen, but you can see how the tummy gets flattened, the reshaping of the tummy, and a lot of times it's from pregnancy. They stretch the skin and the muscle. We can tighten that up as well, but that's a great example.
I know so many girls totally thin that their stomach just, for lack of a better term, was just, ruined after childbirth. Why does that happen?
Well, we got to blame the kids for something. They blame us for everything, too. But essentially, the skin gets stretched. And some people have that problem if they have a lot of, if they're really heavy. If they have the weight gain that they lost at 50, 75, 100 pounds, a lot of people lose that weight after body contouring, body contouring, but also if they lose the weight from gastric bypass surgeries, those weight reduction operations. So these are patients that are coming to the office now a lot more.
Okay, you have another photo for us. I can't wait to see.
Let's look at this one.
What's this one? Oh, what's that?
This is a liposuction. Typical patient that we see. Outer thighs for the women, sometimes the inner thighs, reshaping it so that they lose that saddlebag. This is the ideal patient that we look for. And if the patients aren't quite there yet, through proper exercise and diet, we'll help them get to the area that they need to be, and then we'll do the liposuction on them. How
long can somebody hold that on the right-hand side after they get the liposuction? How long can they hold that shape?
Oh, well, I'd like to think indefinitely. The fat's not going to come back. It's not as if all of a sudden they're going to see that again. But they have to keep that lifestyle. They have to have committed to being healthy, and if they don't gain the weight, they're not going to get that hip stuff back.
So body contouring is like liposuction, or is liposuction?
The body contouring procedures that we perform are liposuction, tummy tucks, breast lifts, breast contouring, the liposculpture, which I was mentioning a few moments ago, all of those things.
Really can change people's lives that way.
I think so.
Give them a better outlook. How do they get more information if they want to come and see you?
Well, I'd like them to call us. We do have a website, too, at
or you can bring them on the show. We'll consult you right here.
Hey, I'd be happy to do that. Maybe one time that would be great. We should consider that. But, they can contact our office, and at 839-1700, my staff will be happy to get them in for an appointment, and we'll talk to them.
Thanks for being here. Appreciate it. All right, coming up next, we go into the kitchen healthy. Chef Fink shares a recipe for Southwest chicken.